All right, she just had her 7th dose of liquid antiviral GS4 or 5, whatever it's called. And this is, let's see, Sunday. Friday, she had her belly drained, fluids. They didn't do all they should have done, but she's been better. I'm hoping another week of this antiviral and her stomach will start shrinking. But it's definitely seeing improvement. I'm not giving her any anti-nausea medication, no appetite stimulant, nothing. I stopped that on Thursday, actually. So Friday, Saturday, Sunday. Thursday, Friday, Saturday. So basically 3 days with nothing other than antibiotic and the antiviral. That's it. So clearly she has FIP, and clearly the FIP medication is working. Other than the fluid buildup, I'm assuming that's going to go away because I think the medication is working, obviously. So you would think a week from now, I'm hoping, fingers crossed, I hope I don't have to take her back to get fluids taken out again. Although it wouldn't surprise me because they only did about half of what they should have. Now get this, when I took her to the ER almost a week ago, well, actually a week ago, exactly 1 week ago, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday. Saturday, Sunday, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday. That makes sense. Sunday, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday. Anyway, jeez. I'm retarded, but anyway. Look at this. She's eating like a king. She does have diarrhea, but I think that's from all the food I was trying to give her and treats just to get her to eat. So I've been giving her probiotics. I probably shouldn't have put probiotics in this right now because I'm getting ready to give her an antibiotic. But honestly, the antibiotic is just precautionary. And she's going to be on antibiotics for 1 more week. Not even 1 more week. Because, well, no, yeah, I'm sorry, 1 more week. Right, girl? You're a good girl, Seraphina. And me and Seraphina have gotten closer. A lot closer. I guess she knows I'm helping her. She was in serious bad shape. And I could already see she started to gain a little bit of weight, her weight back, which is all promising. But then again, I mean, she's got a long way to go. I mean, she's not even a quarter of the way done with her medication, you know? Not even close. Right, girl? I know, girl. Oh, today is Sunday, jeez. Okay. So tomorrow will be exactly 1 week on the medication. And there's 12 weeks. 12 weeks, 11 more weeks of medication. That's how serious this disease is. It was a death sentence for cats. 100% death. Quickly, too. From 2 weeks to 2 months, they'd be dead. And it would not be a good death, so best case scenario is just to euthanize them, because what's the point? But with this antiviral medication, if your cat has FIP, I highly recommend it. If you have symptoms like she had, weight loss and belly expansion, and obviously loss of appetite, That's the wet version. There's also a dry version of FIP. Your cat may be experiencing seizures or some type of eye problems. You might want to look that up. I didn't really look up the dry version. But there is not a specific test, but there are markers in the blood. So you could do, you have to do a blood test to basically tell you if she has FIP. Even though, like I said, there is not a actual test, but there are markers and symptoms. And then they can say, well, we think it's FIP, and then they get you on this, they get them on the antiviral. I don't recommend the shots. I don't recommend the pills. I recommend the liquid. And the place I use is called Avrio Pharmacy. It's a compound liquid. So she gets 1 milliliter a day for 83 or 84 days. And I do have to bring her back in to a good girl. She's eating dry food now. She's going back and forth. But so I have to take her to the vet, my own personal vet, and check her blood, see how she's doing, and maybe, who knows, maybe they will adjust the medication. I don't know. But so far, there's been a major improvement in. I noticed it after 48 hours on the medication. I noticed a slight difference, an improvement. And then she was having issues going to the bathroom, where she was just in the litter box too long, kept going back and forth to the litter box and not producing much litter. And what happened was her belly was swelling up to where it was pushing her kidneys to the side, and it was pushing her bladder, so it was shrinking the size of her bladder. And she just had to feel like she had to pee a lot, and she really didn't, because it was just little pees. But then I went and got it drained, and she was still not peeing massive amounts, but it stopped that going back and forth to the litter box. And it also increased her mood. She obviously felt better and has been eating much better ever since. So the combination of the draining and the fluid draining, they use a needle, I guess, and they just pull it out that way, and then you continue the antiviral, and hope for the best. And all I can say is, I don't see any reason why she's not going to be a success story here. And what I've heard is relapse is like 4% chance of a relapse once they're done, which is impressive. Right, girl? So it went from a 100% death to maybe a 15% death rate. So it's a massive drop with this medication. But like I said, it's a long process. But look at this. It's worth it, you know? Medication was about $280. I'm sure the injections are a lot cheaper. But this is much better and healthier for the cat. Much healthier for the cat, because you don't want to give them injections, painful injections, and likely cancer from the injections. So just stick with, hey girl, I know. Stick with the liquid compound, and just do it. It's better to give it to them on an empty stomach, and don't feed them for probably 2 hours afterwards. Right, girl? I know. Seraphina.